A peaceful afternoon to everyone, especially to our brilliant instructor, Doc Corazon B. Floresca. Welcome to MAID AM 300, which is the concept paper writing. I am Elvira A. Quezon, the presenter of my concept paper with the title, Causes and Factors Affecting the Malnutrition Prevalence Rate in Pag-asa Elementary School. My concept paper is composed of cover page, table of contents. Under the table of contents, the chapter 1, it contains introduction, significance of the study, scope and delimitation of the study, statement of the problem, review of related literature, conceptual framework, operational definition of terms. The chapter 2 contains of methods, research design, respondents of the study, instrumentation and measure, data gathering procedure, research tool or instrument questionnaires, and the chapter 3 contains references. I will read first the chapter 1, which is the introduction. Things that happen in the home can definitely affect a child being able to even concentrate in the classroom. If you're hungry, you can't learn with your belly growling. You're not going to be able to pay attention. The relationship between education and health is never a simple one. Poor health not only results from lower educational attainment, it can also cause educational setbacks and interfere with schooling. Nowadays, more and more children are being malnourished, and it is a serious problem in many countries. According to the World Health Organization, malnutrition refers to the deficiency, excess, or imbalance in a person's intake of nutrients. The Standard Committee claims that malnutrition is the largest single contribution to the spread of diseases worldwide. In Barangay Pag-asa, Calamansig, malnutrition is still rampant and proliferating in the community. The records in Barangay Health Center show that there were numerous cases of malnutrition. In fact, malnutrition is one of the problems that the barangay local government unit is facing today. Malnutrition has a great effect to the lives of the Calamansiginos. The learners will become vulnerable to illnesses, and in the end, their studies get disturbed too. Subsequently, the parents will have to spend time to take care of their malnourished children, in which they lost an opportunity to earn for their living. With this, malnutrition should be slowed down and be totally eradicated. The foregoing circumstances give birth to the conduct of this study. This is a way of uncovering the different factors that cause malnutrition in the community. Through the survey questions, factors will be revealed and were subjected for analysis. In addition, this study serves as the primary step in resolving the issue of malnutrition in Barangay Pag-asa, Calamansig, Sultan Kudarat. According to Diana Olita et al., at 2014, state that causes of malnutrition are child-related factors such as demography, birth story, feeding practices, educational level, and immunization status. Another factor is the parental factors such as the educational level and employment status. Furthermore, it is the socio-economic factors and environmental factors which include the number of people and income learners in the household area of residence, type of housing, sanitation, and water supply. Relatively, this study focused on discovering the said factors that would lead for a consideration of the barangay local leader as basis in finding antidote for malnutrition. Once the factors were determined, then it is easy to make appropriate actions. It is likely the goal of the constituents of Barangay Pag-asa, Calamansig, Sultan Kudarat that their children become free from malnutrition. So let's proceed to the significance of the study. This study would be beneficial to the following entities: To the parents of elementary learners of Pag-asa Elementary School, Pag-asa, Calamansi, Sultan Kudarat, results of the study will serve as their guide on how to take care of their sons and daughters' health. To the teachers, administrators, and staff of Pag-asa Elementary School, outcome of the study will serve as their baseline to create an intervention to address the malnutrition in their school. To the Rural Health Unit of Pag-asa Calamansig, results of the study will help them to know what the causes are and factors affecting the malnutrition rate in Barangay Pag-asa, of which will be possibly used to create project program to address the problems in malnutrition. So let's proceed to the scope and the limitation of the study. This study is delimited only to determine the causes and factors affecting the malnutrition prevalence rate in Pag-asa Elementary School, Pag-asa, Calamansig. The 50 parents, guardians of identified malnourished children will be the respondents of the study, and this will be conducted in Pag-asa Elementary School, Calamansig, Sultan Kudarat. Statement of the problem. This study will investigate the causes and factors affecting the malnutrition prevalence rate in Pag-asa Elementary School, Pag-asa, Calamansig. The study tries to find out the answers to the following questions. What is the extent of factors affecting malnutrition in terms of socioeconomic, knowledge and awareness on malnutrition, environmental community awareness, perception and situation? What is the extent of barangay local unit support as evaluated by the parents? So let's proceed to the review related literature. According to World Health Organization, year 2009, child malnutrition is the crucial issues of developing country, although percentage terms, the share of malnourished children had fallen over the last 30 years around the world. According to Ghana Health Services, year 2007, this study is anchored on the notion that the main cause of the factors of malnutrition should be determined and analyzed so that troubles and problems it gives the parents, people in the community, and the local leaders would be avoided. According to Diana et al. At 2014, however, some factors according concerning their personal habits and ways of handling and caring their children should be known, so that they must be taught, be trained, and according to this article, malnutrition has a negative impact on the body due to the imbalance of energy and other nutrients. Many studies focus on economic and social environment and their inequality as the most important reason for malnutrition. So let's proceed to the conceptual framework. So it is input, process, and output. In the input, it is the independent variables. In the process, it is the giving survey, questionnaires, data gathering, data analysis, data interpretation. In the output, it is the dependent variables, the analysis, investigation, and examination of malnutrition affected by socioeconomic, knowledge and awareness of nutrition, and environmental, community awareness, perception, and situation factors. So let's proceed to the operational definition of terms. The causes, factors, malnutrition prevalence rate, parents of the malnourished children, socioeconomic status, knowledge and awareness of malnutrition, environmental community awareness, perception and situation, malnutrition, syndrome, impairment, morbidity. And let's proceed to the chapter 2, which is the methods. A total of 50 mothers, caregivers of identified malnourished learners of Pag-asa Elementary School will be conducted an interview, survey questionnaires, and will be the program participants of the intervention of study, will employ qualitative methods in systematically documenting and assessing the cause and factors of malnutrition of some learners in Pag-asa Elementary School. The answers of the identified parents of the survey questionnaires will be analyzed and interpreted. Thus, it opens for ideas and necessary measures to counteract malnutrition. So, research design. The researcher must be utilize the descriptive research design. Locale of the study. The area of the study will be conducted in Pag-asa Elementary School, Pag-asa, Calamansig, Sultan Kudarat. The respondents of the study. Respondents chosen were the 50 parents or caregivers of identified malnourished learners of Pag-asa Elementary School. The instrumentation and measure. The instrument that will be used in collecting data is through the answers of the survey questionnaires of the 50 parents or caregivers of identified malnourished children. Before the study was conducted, a request letter will be sent to the head teacher office. Upon the approval of the letter, the researcher was given an access to conduct and gather the data. After the collection, the data was analyzed and compiled. So we have the parent survey questionnaire tool. So we have the statement and the scale. Under the statement, letter A, the economic resources, and the scale 4, 3, 2, 1. The 4 is strongly agree, 3 is agree, 2 is disagree, 1 is strongly disagree. The letter B is the family dwelling. Letter C is eating habits. Letter D is knowledge about nutrition. The chapter 3 is the references. The World Health Organization or the WHO and the UNICEF, Diana et al. 2014. Then RFA, year 1960, Ghana A. Black. Pabani Banmad, Brown and Blusner in 2008. So that's all my report. Thank you for listening. Keep safe and God bless us all.